Home and community-based services are those programs and services that are designed to ensure a person with disability can live within the community with adequate support services and to ensure that they don't become institutionalized. The Homestead decision was a Supreme Court decision that said this was a right, and every state was required to implement certain services. We still see states now still not implementing what the Supreme Court decision said to do. When it comes to the decision-maker in power, disability is not a priority.
I'm Trevor and I'm from Bismarck, North Dakota. My caregivers and we have a great relationship. They assist me every day in getting out of my bed and helping me with feeding, dressing, toileting, my physical therapy as well. I've been working with them for 10 years. I receive services from the state's DD waiver. If I couldn't get the services at home, I would probably be in a nursing home. That's what the waiver allows me to do.
Medicaid will pay for services in an institution, but a waiver is basically allowing you to waive the federal requirements of living in an institution. And you have those same supports that you get in an institutionalized setting, you can get in the community. Problem is, each state has a certain amount of waivers. And when that money is spent, people go on waiting lists. And unfortunately, while waiting for waivers, people can also go back into an institution.
In 2024, in Kansas alone, HCBS waitlists skyrocketed to over 7,500 people, some waiting as long as nearly 11 years. The legislature only provided new dollars to reduce waitlists once since 2016. That only took around 150 people off the waitlist.
We've been trying to transition people out of those institutions, but no one wanted to believe that those facilities were havens for mistreatment and violence. But COVID-19 made it clear those individuals who couldn't leave these congregate settings, they just put them all together and let COVID spread, and they died.
During COVID, I fared better here than I would there. I'm in my own apartment. I can do what I want to do. It lets me have dignity and independence.
Computer, turn off intro light.
Okay. I make all the decisions. There's been studies that people with disabilities that live in the community save the state money. It saves them money and it lets you live an independent life. Another issue that we are having. There is a lack of care workers, and I'll tell you, it is bad. We have situations where staff have to double up. We have clients that they're a waiting list. These staff are underpaid.
I'm Tiffany Wynn. I live in Mechanicsburg, Pennsylvania, and I'm an in-home healthcare worker. I can work from anywhere from 10 hours a day to 14 hours a day to 18 hours a day, but I try to let no patient unattended. That's not me. Wouldn't want it to be my mother or father laying in bed.
We need to increase the wages. People can go to McDonald's and get more.
I go to a lot of meetings and advocate for people with disabilities. I advocate for them. This is how I live. This is the way I want to live for the rest of my life because it's the best for me.
We definitely need those decision makers to recognize that we need more funding. We need more funding for attendant care, direct care workers. We need more funding to increase waivers and get people off the waiting list to keep people living in an integrated setting in a community.
We need more funding for HCBS no matter what. This is not optional, this is mandatory.
Eliminate the wait for HCBS. For more information, contact Disability Rights Center of Kansas at 214 Southwest 6th Avenue, Suite 100, Topeka, Kansas 66603. By phone, toll free at 1-877-776-1541, on the web at drckansas.org, and on Facebook, X, and YouTube at DRC Kansas.